Professor Romanus Okoronkwwo is the Deputy Vice Chancellor, Enugu Campus, Professor Daniel Chukwu Nwachukwu. We also have seated on a high table Emeritus Professor Emeritus. Please can we make the applause very loud? I'd like to quickly recognize Venerable Emeritus Professor N.S. Nwasibe, former Provost College of Medicine. Please appreciate him. The past immediate Deputy Vice Chancellor of this great campus, Professor Edith Mosu. I also like to recognize another past Deputy Vice Chancellor of this great campus and the Dean Faculty of Law, Professor Ifeoma Enemo. Professor Florence Oraboeze, she's held so many offices. Please can we appreciate her? And every other inaugural lecturer, past inaugural lecturer here present. Can we please appreciate them all? Please give us a wave. You're all highly welcome. Quickly, before I hand the microphone over to the chairman, I'd like to recognize His Royal Highness Eze Chijoke Ogbonnaya Mbwala of, oh my God, Mbwala Su of Ugumba. I hope I got that correctly. Please manage me the way I am. Thank you. And His Royal Majesty Anogwese, Engineer Barrister P.N. Anosike, all the way from Ikpeazu Town, Mbise, Imo State. Igwe, you're all highly very welcome. I'll quickly just recognize the children of the inaugural lecturer, and that will be it. Dr. Marachi Okoronkwo, you're highly welcome. We appreciate your presence. Dr. Ngozi Anosike, you're very welcome. Chima Okoronkwo, you're welcome. And Mrs. Uchenna Anya, who will be watching via Zoom, we appreciate your presence. Please put a round of applause for yourselves. It's not easy to be here. At this juncture, permit me to hand the microphone over to the Chairman of Senior Ceremonials to further commence with this event. Thank you very much.
Thank you very much. Good afternoon, everyone, distinguished ladies and gentlemen. On behalf of the Senior Ceremonials Committee, it's my pleasure to welcome you to the 206th Inaugural Lecture of the University of Nigeria. We bring you very warm greetings from the Nsukka campus, main campus of the university, and I bring you greetings from the newly appointed acting Vice Chancellor of the University of Nigeria, Professor Romanus Okoronkwwo. The chairman will explain why he didn't make this trip, because he's the one who is empowered to give his apology. But he sends his regards all the same. So I welcome the chairman, the Deputy Vice Chancellor, Enugu Campus. We're standing in for him. All the principal officers, past and present, who are here with us, deans and directors. I welcome also professors and members of the Senate of the University of Nigeria, heads of academic and administrative units, other staff, the emeritus, professors emeriti, they call them. I welcome in a very special way Her Excellency, Emeritus Professor Uche Azikiwe, who is making a royal presence at our inaugural. Please an applause for... Well, I mean, the applause says it all about how we feel. I welcome also the past Deputy Vice Chancellors of Enugu Campus. It's good to have you here with us today. And of course, we welcome the friends and family of the inaugural lecturer and all those who have joined via Zoom, the great lions and lionesses, especially those from nursing department. I was opposed to that anthem, but did I like it? Yes, I did. I enjoyed it a lot. You know, thank you very much. And so my job is done. I most respectfully invite the chairman, Professor Daniel Nwachukwu, to please give his opening remarks and formally declare today's inaugural lecture open.
Good afternoon, ladies and gentlemen. The acting Vice Chancellor of this great university, Professor Romanus Okoronkwwo, principal officers of the university here present, Her Excellency, Emeritus Professor Uche Azikiwe, I think this is my first time of meeting you, so I feel highly honored to have you in Enugu campus. Emeriti professors here present, past inaugural lecturers, deans of faculty, heads of academic and administrative units of the university, distinguished professors of the university, distinguished members of the university senate, members of the Fourth Estate of the Realm, gentlemen of the press, Your Royal Highnesses, my Lord spiritual and temporal, distinguished ladies and gentlemen, lions and lionesses. We've gathered as usual yet again for another inaugural lecture. At this point, Chairman of Senate Ceremony, I must commend Enugu campus for doing a great job. We deserve a hand of applause. I feel that Nsukka, which is the main campus, should emulate us in the rate at which we'll give inaugural lecture. You can see that Enugu campus, back and back, we've been giving inaugural lecture and we'll continue to do so. I also want to use this opportunity to tell our colleagues who have not given to come and give. There is nothing there. Just brace up and come and give your inaugural lecture. The whole faculties have been trying. The only faculty that I'm still yet to hear from is the Faculty of Law. That's the faculty that I've not given since I assumed office, and I am putting up a challenge. I want to see if someone from Faculty of Law, the dean is here, who is my own organ. So please, other faculties have been trying, and I think we should continue on that note. Ladies and gentlemen, we are here today to listen to a very interesting topic by one of our own, Professor IJEOMA OKORONKWO, who is one of the pioneer professors from the Department of Nursing Sciences. The title of her lecture is Nurses from Silence to Voice in the Nigerian Healthcare System, the journey of a transformational nurse academic. And of course, we all know the purpose of this, here to listen to PROF to tell us why the university deemed it necessary to bestow on her or to elevate her to that enviable position of a professor. She's going to tell us her journey. That journey, we know her for who she is. A transformational nurse academic. You are going to listen today, and I believe this lecture is going to be very impactful. It promises to be exciting. As you pay attention for the next 1 hour, the lecture will last for 1 hour. As you pay attention, I am sure you're going to go back fulfilled. I want to thank all of you for finding time to come and, listen to our sister deliver this important inaugural lecture. And for the next 1 hour, I believe we are going to be happy and be satisfied for attending this lecture. On behalf of the acting Vice Chancellor, I declare this inaugural lecture open. Thank you.
Well, thank you, Chairman. It is true that the Enugu campus has kept my committee on its feet. It's tough, but we signed up for it, so it's okay. Take up the challenge and we'll rise to the occasion. We'll be here to host as many of those lectures as possible. And I have not had a chat with the acting Vice Chancellor about this, but I'm sure he will fund the inaugurals just as his predecessors did. So there's nothing to be scared of. And so that done, I invite the Dean of the Faculty of Health Sciences and Technology to read his citation and formally introduce the 206th Inaugural Lecturer. Please join me to welcome Professor Charles Ugwokeze, Dean of the Faculty.
Good afternoon, ladies and gentlemen. The acting Vice Chancellor, University of Nigeria, ably represented by the Deputy Vice Chancellor, UNEC, Professor Daniel Chukwuemeka. Past inaugural lecturers here present, the Provost, College of Medicine, and Deputy Provost, College of Medicine, Professor Emerita, ladies and gentlemen, it is with great honor and privilege that I stand here to read the citation of Professor IJEOMA LEWECHI OKORONKWO. IJEOMA LEWECHI OKORONKWO, like Diego Maradona and Pelé, who paid their dues in the game of football and who arguably, undoubtedly are the best footballers ever. Professor IJEOMA LEWECHI OKORONKWO. She is the 206th inaugural lecturer of this famous university. She was the second child of late Mazi Oji Nkamanachi and elder Mrs. Grace Nachi, called the First Lady of Ebuana Elder in Afi South Local Government Area of Ebonyi State. She had her primary education in several cities as a result of movement of her parents, but ended up at Elder Central School in Afi South Local Government Area, where she obtained her Standard 6 certificate just before the Civil War. She started her secondary education at Akanidian Secondary School Afikpo and later finished up at Holy Child Secondary School, Abakaliki, where she obtained her West African School Certificate in flying colors. Afterwards, she gained admission into the School of Nursing and School of Midwifery at Hospital, Afikpo, respectively. After her graduation, she worked briefly at National Medical Hospital, Enugu, before getting admission into the Department of Nursing Sciences, Faculty of Science and Technology, University of Nigeria, Enugu campus, in 1983. And she was among the 5.5 set of students of the department. She graduated in 1986 as the best graduating student in Faculty of Health Science and Technology, as well as the best graduating student in the Department of Nursing Sciences. She also received the Pomodegu Prize for the best graduating student among several others. She obtained her postgraduate diploma in management, that's PGD, in UNN in 1990, Master of Business Administration in UNN in 1996, Fellowship of the West African Postgraduate College of Nurses and Midwives in 2001, Doctor of Philosophy, that's PhD, in management in 2006, and then postgraduate diploma in public health, University of London in 2009, and Master of Science in Health Services Management and Health Economics at the same University of London in 2011. So, ladies and gentlemen, you can believe that she has really made her dues as far as reasoning is concerned in this area of her specialty. They had a little John. He joined the Faculty of the University of Nigeria in 1997 as a lecturer 2. Got promoted to lecturer 1 in 2000 and became a senior lecturer in 2004 and was promoted to the rank of a full professor in 2014. And was among the 4th batch of impact factor professors in this famous university. Position of responsibilities. Professor IJEOMA LEWECHI OKORONKWO has paid her dues as far as responsibility is concerned in this famous university. She has held many positions of responsibility, which include head of departments, associate dean, Faculty of Science and Technology, dean, Faculty of Science and Technology, and she has been chairman and a member of several committees, too numerous to mention because of want of time. She has also served as a sound examiner. In fact, she is an accreditation veteran both for LUC and her professional body in her area of specialization. She has also served several professional bodies, two medals to mention here, but which includes Chairman, West African Postgraduate College of Nurses and Midwives, Nigerian chapter. She was also former president of Nurses in AIDS Care and Nigerian chapter. Secretary General, West African Postgraduate College of Nurses and Midwives. Member, National Health Research Agencies Committee. Board member, Lead Nurse African International. Now, publications and conferences. She has also paid her dues in this area. She has collaborated with so many colleagues and the PG students and published more than 90 peer-reviewed articles in reputable international and international journals, with many in impact factor journals. She has also paid her dues as far as postgraduate training and mentorship is concerned. Of course, we may not know that her other name is Madam Mentor and Professor of Professors. So she has graduated 12 PhD students from both departments, that is nursing sciences and health administration and management, and supervised and graduated over 100 MSc students who are now in various managerial positions across the country and beyond. She has attended and presented over 40 papers in national and international conferences. Professor IJEOMA LEWECHI OKORONKWO is a devout Christian, a former member of the parochial church council of Christ Redemption Anglican Church, Enugu, and a member of the medical research team. She enjoys singing and writing, and she's blessed with 4 lovely children and 4 grandchildren to the glory of God. Mr. Vice Chancellor, sir, distinguished ladies and gentlemen, may I crave your indulgence to allow the big masquerade and the chief priest of today's intellectual harvest to come out and present her long-awaited inaugural lecture.
I love you, Lord, for your mercy never fails me. All my days I've been held in your hand. From the moment that I wake up until I lay my head, I will sing of the goodness of God. All my life you have been faithful. All my life you have been so good. Every breath that I am able, I will sing of the goodness of God. All my life you have been faithful. All my life you have been so good. With every breath that I am able, I will sing of the goodness of God.
Music department, thank you very much. The acting vice chancellor, Professor Romanus Okonkwo, deputy vice chancellors, the provost of the College of Medicine, provost College of Postgraduate Studies, emeriti professors and professors,
past inaugural lecturers, other principal officers of the university, deans of faculty, directors of institutes, heads of departments, heads of administrative units, distinguished academic staff, members of my family, my lords, spiritual and temporal, His Royal Highnesses, Ndigwe, Eze, and chiefs, distinguished guests, virtual audience, because I know majority of my students are watching, gentlemen of the press, great nurses, lions and lionesses, ladies and gentlemen. This lecture is dedicated to my late husband, Chief OKORONKWO, who gave me all the support I needed to attain this height, but could not live to witness this day. May his soul and the souls of all the faithful departed rest in perfect peace. Amen. My gratitude goes to God, for thus far he has been my Ebenezer. I am grateful to my parents for the solid foundation they laid for my academic prowess. I appreciate the former Vice Chancellor and the Chairman Senior Ceremonials for giving me this opportunity, and also my guests for making out time to come and listen to my story. I wouldn't waste time with family upbringing since the Dean has mentioned some of them, but permit me to go straight because of want of time. After my secondary school, I went into nursing school at Mater Misericordia Hospital, both the School of Nursing and the Midwifery at Afikpo, and obtained my registered nurse and registered midwife certificates. Thereafter, I went to work at Orthopedic Hospital briefly, before getting admission into the Department of Nursing Sciences, University of Nigeria and Nsukka Enugu campus in 1983, among the pioneer set. I graduated in 1986, as I was also mentioned, being the best graduating student both at the faculty, department, and also received Dr. Mojeku Prize. I went back to orthopedic because I came with study leave without pay. I went back to the National Orthopedic Hospital, but then I was employed as a nurse educator and left when I became principal nurse educator because I gained admission into, I entered into the Department of Nursing. I was employed there. But to acquire more knowledge, I sought admission and successfully obtained postgraduate academic and professional programs. As I also mentioned, PGD, UNN, Masters, UNN, then Fellowship of the West African College, 2001, Postgraduate Diploma, University of London, 2009, and Master of Health Service Management, University of London, 2011. Choice of title for today's lecture. I assumed duty in October 1997 as Lecturer 2 and rose to the rank of a full professor in 2014. My management background shaped my thoughts in the health system and the nurse. My interest in the health system was intensified in the Department of Health Administration and Management, where I have a joint appointment since 2004. Again, my lengthy coordination of the Nursing Administration and Management Unit deepened my insight on nurses and also the profession. Again, as a resource person to nurse leaders in the Human Resource Program of the West African Postgraduate College of Nurses and Midwives, and also the Continuing Education Program of the Federal Ministry of Health, questions about the nursing profession were built. And such questions that came to my mind concerning the nursing profession. Where are we now as a profession? Where do we want to go? And how do we get there? These questions motivated me to raise the voice of nurses in the health system as I became so uncomfortable with the goings on in the profession. I began raising the consciousness and assertiveness of nurses in the health care system through my lectures, seminars, and conferences. Consequently, my research contributions to knowledge have centered on nursing and the health system. As earlier mentioned, I've taught over 3,000 nurses and 200 health administrators, graduated 12 PhD students both in both departments, who are now in various managerial positions across the country. They all made today's lecture possible. I am a member of the editorial board of the International Journal of Medicine and Health Development of College of Medicine, also member editorial board of the African Journal of Nursing and Health Research of Nursing and Midwifery Council of Nigeria. I'm a board member of Lead Nurse Africa International, an association with a vision to see all nurses in Africa become transformational leaders. I am external examiner to various universities and serve in the accreditation team of both the NUC and Nursing and Midwifery Council. I have served the university, the West African Postgraduate College of Nurses and Midwives, and the Federal Ministry of Health in several capacities. As the first indigenous head Department of Nursing Sciences, I celebrated the Silver Jubilee anniversary of the department in 2008. I was head Department of Health Administration, where I have a joint appointment for 5 years. I became Associate Dean of the Faculty 2014-2016, and Dean of Faculty 2018-2020, and hosted the first alumni homecoming in 2019. I was Director Youth Friendly and Resource Center Enugu Campus from 2014 to 2020. Nigeria Chapter Chairman, West African Postgraduate College of Nurses and Midwives 2015-2017. Secretary General, West African Postgraduate College of Nurses and Midwives 2017-2019. Member, National Research Ethics Committee of the Federal Ministry of Health 2017-2024. As well as several committees, both at the departmental, faculty, and college levels. I received the Vice Chancellor's Faculty Award of Excellence in 2015. Introduction. Today's topic was derived after reading a book by Buresh and Gordon titled From Silence to Voice: What Nurses Know and Must Communicate to the Public. Underrepresentation of nurses in the news motivated a writing by the authors, who were journalists. The authors averred absence of nurses in healthcare reports, despite their numbers and roles. Other works of literature supported that nurses are the silent majority in the health sector. With my nursing training and experience, I agreed with them. Why and how nurses found themselves in this quagmire, and how to end the silence and have a voice in the health system became my driving force. As defined by Pike, nurses' voice is referred to as the unique perspectives and contributions that nurses bring to patient care. Minagi also says that no one runs the hospital better than the nurse. Nurses hold the system together, but they do not have a voice. The both views confirm that nurses have been silent about what they do and how they do it, despite being the backbone of health system. Now, what is a health system? It's an organization of people, institutions, and resources for population health needs. Nurses are the largest of the healthcare system, yet they are unnoticed in policy development, especially in low and middle-income countries. Their contributions are undermined, overshadowed by other healthcare professionals. They were predominantly viewed as playing subservient roles, and of course, extension of doctors' orders. Nurses couldn't voice their concern or contribute to healthcare policies, undervaluing their inputs. What were the factors responsible? Traditional societal norms, gender biases, hierarchical structures within the healthcare system. Although Florence Nightingale saw nursing as an independent profession, not subordinate but equal to medical profession, it was still seen as a paramedical. The medical dominance strongly influenced the role development, the image, and the position of nurses. However, the 21st century changes, complex challenges, and continuous reforms are now shaping healthcare industry, both the nature, scope, and roles of healthcare professionals, especially that of the nurse. In 2015, 17 Sustainable Development Goals were adopted to ensure healthy lives and promotion of well-being for all. Universal health coverage is among the 8 targets of the SDGs. The SDGs and the UHC brought to limelight the need for nurses' voice to be heard in the health system. Remarkably, Florence Nightingale, who was quite a voice in nursing, identified the precursors to these SDGs. She defined the art of nursing, the sick, and emphasized the importance of health and nursing. She educated marginalized communities and identified today's societal determinants of health. The SDGs emphasize safe housing, access to health and education, and of course, public safety. Nurses can be a voice to lead in achieving the SDGs by supporting a people-centered approach to care and influencing health policy. Today, I want to take you through the journey of how nurses have transitioned from silent observers to having an influential voice in the healthcare system. But before that, a bit of nursing history, because I know majority don't know about nursing, and that's why we have the various images that occur. Before the Nightingale era, nursing was primarily a family matter, by mothers caring for their families or neighbors assisting each other. Nursing came to limelight in 1854 when Florence Nightingale and 38 nurses stood out in the care of the sick and injured men during the Crimean War. Her persistence and dedication day and night made her famous, and she was nicknamed the Lady with the Lamp. Her services changed the worldview of nurses and marked the beginning of professional nursing. By 1880, the status of nursing improved with the establishment of hospital-based schools of nursing throughout Europe. In 1882, the first movement for recognition and registration of nurses began. In 1899, nursing became the first profession in the health industry to form an international organization, the International Council of Nurses, in Geneva, Switzerland, mostly in missions hospitals and few existing government hospitals. Later in 1952, the University College Hospital started training nurses on higher standard. September 1964, Department of Nursing, University of Ibadan was founded to meet the increasing scientific knowledge and ever-changing needs of the society. In September 1965, the first admission of BSc nursing students in Nigeria was conducted in Ibadan. This was followed by the Obafemi Awolowo University, 1973, and University of Nigeria, Nsukka, 1983. The rest is now history. In 1949, the Nursing Council of Nigeria was founded and operated parallel with the Midwives Ordinance of 1930. Decree 89 of 1979 merged the two bodies into Nursing and Midwifery Council of Nigeria to regulate nursing education and practice, and of course register all cadres of nurses in Nigeria. ICN has defined who a nurse is as somebody who has basic generalized nursing education and is authorized by the appropriate regulatory authority to practice nursing in his or her country. That individual must be prepared and licensed to practice the general scope of nursing. This inaugural lecture is organized in 3 parts: the era of silence, the present or current era of transition to voice, and of course the future voice of nurses. Now let's briefly look at the era of silence. During that period, nurses were seen as passive actors, keepers of peace, keeping conducive environment for the sick to recover. Of course, the above roles are akin to the female gender. When we talk about silence behavior, it refers to nurses choosing to withhold their ideas, opinions, and of course, concerns about critical issues in their workplace and their personal needs. This culture became a norm and gave rise to decades of marginalization and muted voice in the healthcare system. Their insights, observations, and expertise became dismissed or overshadowed. preventing their participation in patient care decision. Causes of the silence were both external and internal. The external factors were the hierarchical structure of the healthcare organization, which limited the role of nurses in decision-making, the historical role of nurse as handmaiden, perceived authority and directives of physicians, hospital policy, and the threat of disciplinary action. Internal factors include lack of assertiveness, lack of professional confidence, role confusion. We shall take a look at just one external and one internal for want of time. The hierarchical structure as a cause of the silence. We found that most structure of the healthcare organization entrusted leadership to physicians. Nurses were in assistant leadership roles. Also, in most places, most organizations, director of nursing services did not have equal status with other unit heads or directors. There was limited involvement of nurses in national healthcare policy and politics. We carried out a study to find out why this was happening, whether they were involved in policy making. And of course, the result also shows that 72% of the nurses were not involved in policy making, irrespective of age, length of service, and educational status. Major barriers were individual, organizational, and professional dichotomy. There is need to address these barriers and place nurses rightly to enhance quality patient care and health outcomes. Lack of assertiveness as a cause of the silence. Assertiveness means being self-assured and confident without being aggressive. It means ability to stand up for your own or other people's right, calmly and positively. However, studies have shown that nurses are not assertive in their communication style in the workplace. Also, an assessment study found that 40% of the nurses were somewhat assertive. Assertiveness behavior of nurses and nurse managers were the same. Assertiveness behavior increased with higher education. We also recommended that instituting assertiveness training in the program of nurses should be done. And again, continuing education program for managers to improve communication skills. We also find that the era of silence also influenced the image of nursing and its visibility. Some representations and misrepresentations have shaped the image of the nurse and the profession. Again, the overwhelming female phase of nursing also seemed to affect their image. In the past, nurses were trained to be seen and not heard. They were known as angels of mercy, as they silently went about caring for the sick. Over time, several other images emerged, some positive, some negative, like doctor's handmaiden. Also, there were misrepresentation by the media. For example, in TV series that they call Clinical Matters, which portrayed the nurse and the profession in bad light. These images could be attributed to the seeming passive posture and less assertive culture of nursing, resulting in underreporting of the truly heroic exploits of many nurses. Again, a study was carried in 2012 in 4 Anglophone West African countries concerning the image of nursing. The results show generally poor image of nurses. Nurses' work was seen as a job that can be done by anybody. Nurses were perceived as peripheral subordinates, providers of custodial care, and gender stereotypes. Image improvement strategies in different West African settings were suggested. But in all this, we find that personal experience informs the public view about nurses' image. But they cannot Now, the present voice of nurses. The Institute of Nursing and the Robert Wood Johnson Foundation report, The Future of Nursing Leading Change, Advancing Health, in 2011, acknowledged nurses as the leaders and agents who will transform the healthcare system, ensuring that care is patient-centered, effective, safe, and affordable. This vision is a blueprint for action and requires every nurse to use evidence-based research and collaboration to improve healthcare. Today, nurses' contributions are recognized and valued. We have nurses with higher degrees and professors. In 2023, 2 nurses were appointed vice chancellors of universities in Nigeria, and others into appointive and elective political offices. Nurses now recognize the importance of sustainable health systems that can address current and future healthcare needs. Nurses' advocacy voices have increased, and they are increasingly involved in quality improvement. They have challenged the status quo, raising the voice of nurses through research outputs. Some notable nurses who have proved their status include Emeritus Professor Chi Okafor. I'm sure she's watching somewhere. Professor Mildred John, Professor Priska Adejuma, the inaugural lecturer, among others, have made breaking research outputs in Nigerian healthcare system. Emeritus Professor Chi Okafor was the first head of Department of Nursing Sciences, UNEC. She contributed a lot on women's health and safe motherhood projects. The overall project was designed to contribute toward the reduction of maternal mortality and morbidity, involving rural women and community leaders. She developed and implemented curricula for training of TBAs. She identified and addressed some of the underlying cultural factors in maternal mortality and morbidity. Her projects were funded by MacArthur Foundation and UNFPA. Professor Mildred John is a professor of nursing and the first head of Department of Nursing Science in University of Calabar. Her research contributions in value-added nursing care include wound care, using the 4 conservative principles of Myra Levin, also redefining the image of nursing. She has also conducted researches on costing and marketing nursing care, reduction of medical errors in hospitals, and nurses' caring behavior, among others. Professor Adejuma is a professor of medical surgical nursing from the University of Ibadan. She was selected in 2004 as the principal investigator on a multi-site study of assessment and implementation of HIV/AIDS prevention activities in Africa by Ford grantee organizations. Also, her contributions to knowledge in effects of genetic nursing education in counseling people with family history of cancer was brought into oncology nursing in UCH, again in LASUT and LUT. In 2022, she joined 32 other world-renowned nurse researchers to be inducted as member of the famous International Nurse Researcher Hall of Fame in Scotland, United Kingdom. These are all nurses that have made the voice of nurses to be heard. Now, my contributions to quality and evidence-based practice. We carried out a multi-country investigation to create a model of nursing practice in sub-Saharan Africa based on population needs, current practice, and expectations of stakeholders. So this study was carried out in 4 Anglophone and 4 Francophone countries. We were able to identify 9 roles. You know, it was a focus group discussion and, again, document review. We also studied 734 nurses, their current practices. At the end, we were able to identify 9 roles from the triangulation of data: the provision of holistic care, health education, managing the care environment, advocacy, providing emergency care, providing midwifery care, prevention and management of infectious diseases, diagnosis and treatment. 3 contextual support factors were also identified: positive policies and practices, enacted regulatory framework, and also an enabling educational system. This study provided a detailed description of what nurses are doing and or should be doing in the health services of the regions. The study recommended that findings from this study be used to advocate for instituting the prerequisite conditions in every country. The study was supported by the University of South Africa, Department of Nursing. Again, we find that we've been battling with the nursing process over time. And we looked at it. You know, it's something that was brought down to us. And we tried to see whether we can develop something that is indigenous to us and test it. And that was the study, to develop and test a nursing documentation format that will capture nursing activities in our own environment. At the end of the day, all the participants agreed that the model was adequately developed in design and contents. They also agreed that the model clearly stated the information needed. The result also showed that the model was valid and reliable, and of course, user-friendly. Majority prefers this model to the ones they were using. The study concluded that nurses desire to have their patient care completely documented and recommended that hospital management should adopt this model for use in patient care. Still on quality and evidence-based practice, a lot of complaint has been seen in nursing, in the healthcare system, concerning quality of care. We looked at it and said we can develop something that is generic to our own environment. And that gave rise to the study. We developed generic quality nursing care indicators for low and middle income countries through a modified Delphi consensus. And at the end, we were able to come out with 70 items. After going around first round, second round, through the experts that were involved, we reached a consensus of 70 items, structure 28, process 32, and outcome 10, based on the Donabedian theory. Finally, the study produced these 70 that we can use as indicators to monitor quality care in our own environment. So based on these items, the structure, process, and outcome measurement, the study recommended their use by clinical nurses working in healthcare facilities in our own environment. Also, we assess patients' experiences for quality of care on 5 domains: waiting time, the outpatient environment, quality of doctor's care, quality of care given by nurses, and of course, responsiveness to care. You know, most often we find patients coming to the hospital, we don't know what they feel. So we decided to look into their perspective, and then we came out with this finding. Patient experience for quality of care in outpatient service the mean was 74.3, with a standard deviation of 0.32. There was statistical significant difference among hospitals for mean patient scores on waiting time, quality of doctor's care, and overall quality of care. Education and employment status of patients determine how patients receiving outpatient service perceive the quality. And we said that in order to ensure equity, there is need to institutionalize patient-centered care, while full consideration is given to the patient's socioeconomic status. My contributions in achieving equitable health care. We conducted a study titled The Long Walk to Universal Health Coverage, Patterns of Inequities in the Use of Primary Health Care. Again, findings show that only 46.9 utilize the primary health care services regularly. Services mostly utilize immunization, treatment of common ailments, maternal and child health. The least poor utilize PIC services the most. The very poor and poor use PIC services least. We found there were statistically significant association between utilization of PSC and gender, level of education, and income. We find that most women come to the clinic with cervical cancer or breast cancer very late. We decided to look into the why, whether financial barriers to utilization was a problem, to analyze the equity across socioeconomic status. So we saw women that attended the clinic. We carried out the study with them. The cost of medical treatment and not having insurance coverage were major financial barriers. Again, the least poor and poor socioeconomic status groups utilize screening services and treatment more frequently. The study concluded that financial barriers limit the ability of women to utilize screening and treatment services for early diagnosis. And there was need to look into it so that they will have financial coverage to relieve their catastrophic expenditure. Similarly, we designed a study to assess the practice of breast self-examination. The results show that a little above half of the respondents understood the meaning of BSE. Few of them knew that BSE increases survival rate from breast cancer through detection of abnormality. Majority of the respondents did not know abnormalities to check while carrying out the BSE. Only few respondents knew that BSE should be performed by every woman. There was positive relationship between respondents' awareness of breast cancer and their practice. Again, we evaluated the performance of the intervention of midwife services scheme that was introduced in 2009. We carried out that in rural primary health facilities in Enugu State. Findings revealed that there was initial increase in the proportion of pregnant women that attended antenatal care, an increased number of deliveries by midwives, increased number of family planning from 2012 to 2013 when compared with the baseline, what it was in 2009. There was also an increase in infant-child immunization in the selected health facilities. However, there was a noticeable decline in 2014. The reason was not far-fetched due to irregular non-payment of salaries and allowances. And of course, today we know the rest is history concerning the midwife services scheme. Also, there are other contributions in maternal child health, antenatal care, which we carried out randomly in selected villages in Anambra State. Again, we looked at the prevalence of late booking in Southeast Nigeria, and we found that it was high. We then conducted a study to determine the maternal, sociocultural, religious, and institutional systemic factors that determine late booking. Results show that health status in present pregnancy, ignorance of proper gestational age, people did not know when they took it, experience from previous pregnancies, husband decision, preference for mother-in-laws, friends, and other women's advice, preference for prayer and faith healing, long waiting time in hospitals, very frequent antenatal care schedule were determinants of late booking among pregnant women. We also examined the perceptions of midwives on person-centered maternity care. That was a focus group discussion and came out with these themes: respectful care, empathetic caregiving, prompt initiation of care, paying attention to women's psychosocial support, trust, and altruism. All these enhance person-centered maternity care. In contrast, verbal and physical abuses were common. Midwives rarely involved women in decisions about their care and choice of birthing position. Supportive care was constrained by restrictive policy on birth companion. There was poor working condition and cost of childbirth care. The study identified areas where midwives should build competencies to deliver person-centered maternity care. Again, we investigated the differences in health-related quality of life of employed and unemployed women with normal vaginal delivery and the associated socio-demographic variables, and came out with these findings. Employed women reported low health-related quality of life. Women with higher education and personal income reported higher health quality of life. Employed women had more problems with physical health and were more negatively affected by increasing age. The study concluded that increased responsibilities, increasing age, and low SES reduce women's health-related quality of life. I could go on and on with other contributions I have made in knowledge But for want of time, I've just listed some of them so that I can go over to the future and expectations. We also carried studies on critical determinants of demand. That's looking at the role of NHIS in achieving SDGs and universal health coverage. Based on the findings we got on the demand for it, strategies to improve demand for services of social health insurance program using the enrollee was also conducted. Again, we have also conducted research on perceived utilization of national health insurance among staff to see how staff perceive the utilization, because in the social health insurance, workers are supposed to enroll. Apart from the staff, we also looked at the client perceived satisfaction, whether the clients who were enrolled were satisfied, and what was the responsiveness. So these were conducted to assess what NHIS is doing in order to achieve SDG. Again, also other studies on communicable and non-communicable diseases. Factors influencing utilization of intermittent preventive treatment of long-lasting insecticide treatment nets. We know that pregnant women are vulnerable and under 5, and so we had to find out factors influencing their utilization of these. We also looked at virologic response to antiretroviral therapy in order to find what was reducing the viral load. We also studied economic burden and catastrophic cost among people living with type 2 diabetes mellitus to see whether what they are spending is catastrophic, and that will enable governments to look into the expenses being carried out by people living with type 2. And we also went further to look at the socioeconomic inequities and payment coping mechanisms used in the treatment of type 2 diabetes. We also looked at economic burden and catastrophic costs among people living with sickle cell disease to see the economic burden, the expenses, the catastrophic costs they were experiencing to enable healthcare policies make decisions concerning them. We also investigated household catastrophic health expenditure and coping mechanisms in patients with chronic kidney disease. These are diseases we find that a lot of money is being spent, and we find that most of them are not covered by the national health insurance. So findings will enable policymakers to look at what these individuals are spending, because as they spend money from their pocket, it makes them to become poorer. The money that should have been used for training their children, having better feeding, accommodation, are all diverted to what? Healthcare costs. So these were the outcomes. These were the studies we carried out. And of course, we found the findings were very much revealing. On human resource for health, we also looked at determinants of job satisfaction and retention. These days, we find that the majority of the healthcare professionals are leaving the country. So we had to find out what are the determinants of job satisfaction. What can retain them in the public sector? Again, we evaluated nurse managers' use of employee empowerment. That when you empower the employee, they are motivated to work, and leaving the country will be a second thought. So these were other contributions that we did in search of getting the voice of the nurse to be heard. Now the future voice of nurses. The International Council of Nurses has since 2017 to date choosing themes which center on nurses, a voice to lead. This event is aimed at raising awareness about nursing as a profession, and also the contribution made by nurses towards healthcare. The aim of these teams is to make nurses to become active and vocal in policy development and implementation. Again, we have Nurses on Air. It's a TV project. You remember during the era of silence, we had a lot of misrepresentations from the media. So nurses this time around have organized themselves and formed what we call Nurses on Air. a TV project to inform the general public about the activities in the nursing profession. This is the first of its kind.
Chair.
This is the first of its kind in Africa, a comprehensive TV project, a platform. Okay. The first of its kind in Africa. It is a comprehensive TV project, a platform where nurses can connect with the public, at least to diffuse all the misrepresentations that have been made by the media. So we now have Nurses on Air TV project to inform the general public about the activities of nurses, what they do and how they do it. Again, in the future voice of nurses, we have the Lead Nurse Africa International. I believe the founder is also watching online. Mr. Kolisoko, who is an alumnus of the Department of Nursing Sciences, UNEC. It is an organization of young, talented nurses established with a vision to empower African nurses to become transformational leaders. In this Lead Nurse Africa, we started with Rwanda to inform nurses. We came down to Nigeria, carried out studies in workshops, conferences at Lagos. We went to Ebonyi State, Abakaliki, and again, we went to Ghana. We were about going to Kenya when the lockdown came. So the organization is still on, and we want to continue so that nurses will become transformational leaders. Now, what are the expectations for the future? Having heard the future noises, the ICN is urging every nurse to speak up, to take the lead, especially in the SDGs and the universal health coverage. What are our expectations for the future? One, evidence-based practice. It is the in thing. The emphasis is on outcome of care. Nurse educators and practitioners should engage in collaborative practice. It is not just the educators to do that. So we should collaborate with others in the healthcare to come out with evidence-based practice. Again, technological advancement is playing a greater role in nursing education and practice. We find the use of electronic health records that will give information, help nurses to make the informed decisions concerning patients. We also have simulations where students can, this provides students with practice and skill, in a safe environment. Again, we have online learning and mobile applications. These are flexible learning formats that have been provided, which technology is now providing for the nurse and other healthcare providers. Now, interprofessional collaboration. Nurses to work closely with other professionals to provide comprehensive and high-quality service. It's no longer the time to work alone. We have to collaborate with others if we must lead the healthcare service. So, in the same way, our students, right from the training period, there should be that collaboration in all the health. Say we have College of Medicine, and we teach students. So there should be interprofessional collaboration starting right at that stage, so that when we come out, they know that we should work together, we work as a team to give the patient the best. Growth of nurse-led clinics. The things that are happening in the developed countries are coming down here in Nigeria. the advanced nurse practitioners. That's the in thing in the developed countries. The growth is rising. They have clinics, you know, and we find that patients, I talk about nurses for 11 consecutive times, you know, getting reward, getting the award of being trusted, the most trusted healthcare professionals. And we find that now patients or clients prefer going to these nurse clinics because they have to relax, the nurse interacts effectively. It's not you're just 1 minute, you tell her, go, I've heard your complaint. So they prefer these nurse clinics. So these are the things that we're expecting. So there is a rise in advanced nurse practitioners, providing a diverse range of services, from preventive care to managing chronic diseases. Greater emphasis on preventive care. Nurses have been at the forefront of this, providing promotion, health promotion, and preventive measures against diseases. This is what they learned right from basic schools and the universities. And so now that we're talking about going back to the grassroots, they should be at the forefront, providing health promotion and preventive measures against diseases. Growing demand for nurses. This has raised the voice of nurses as never before in the health system globally. The growing demand for nurses. There is an eloquent testimony concerning this. Everybody wants to become a nurse these days. In the Department of Nursing, we don't have a room. The place is flooded during admission. Apart from admission, the change of course. Everybody is clamoring to become a nurse. In fact, in 2022, we had more than 2,000 change of course alone. And in 2023, it was tripled. We don't even find a place. So that's the growing demand for nurses. And when I look back, that's why I said my journey. When I look back what I had in 1983 when we came in, during the physiology class, when we came in, they were looking at us. What are these people coming to do in the university? I thought their place should be in the hospital. It was only one professor, I think, of late, Ezilo, who, during class with medical students, will, you know, when he asks them, they will not answer in physiology. He said, what are these nurses? Please, can you tell them? And that was when they knew that nurses knew something. Because we'll come and tell them, because these were systems. You know, the various systems. We had studied them before coming to the university. And that was when they started, oh, so these people knew something. I thought their place was just in the university. So now there's growing demand for nurses. And it has raised the voice of nurses as never before. Importance of nursing education. Again, every nook and corner, both the private, the state, and even the federal. Everyone is demanding for a place in nursing education. So nurses hold a prominent position in the future trend in nursing education and training. And with all these expectations, we have eloquent testimony that nursing is no longer the silent majority. You can agree with me. In conclusion, the journey of nurses from silence to voice has been remarkable. Nurses were silent until they found a voice. Advancement in nursing education and practice is advancing this voice. Giving nurses all the support will improve the health of the general populace and sustain the voice. This year's ICNT was Our Nurses, Our Future, the economic power of care. So we are asking for support that will improve the health of the general populace. Together we can shape the future of healthcare and ensure that nursing remains at the forefront, leading change. Appreciation. Appreciation. I thank the Almighty God for thus far He has been my Ebenezer. His love, mercy, and grace saw me through. He has always led and directed me in all that I do, reflecting my name, IJEOMA. I acknowledge the Holy Spirit, my best friend, my senior partner, and greatest teacher. In you alone I live, move, and have my being. Thank you for directing me in all that I do. I return every glory to God. My appreciation goes to the former Vice Chancellor, Professor Charles Arinze-Chukwuigwe, and the Chairman, Senior Ceremonials, Professor B.C. Wanguma, for giving me this opportunity to make this presentation. I thank immensely Professor Benjamin Sio Zumba, the 14th Vice Chancellor, under whose tenure I was pronounced a professor. I appreciate my late father, Maazodi Kamanachi, who did not live long to witness my educational career. A career civil servant whose wisdom and knowledge was sought after in the community, wherever he was home. A counselor par excellence. May your soul continue to rest in peace. In a very special way, I appreciate my beloved late mother, Elder Mrs. Grace Nachi, First Lady, whose love, care, gave me and my siblings hope and solid foundation to become what we are today. Although you saw us becoming PhD holders, but you did not live to witness my pronouncement as a professor. Your hard work and sacrifices in training us was not in vain. May your gentle soul continue to rest in the bosom of the Lord. I appreciate the love, support, and prayers of my siblings. Dr. Ngozi Umunakwe, I'm sure she's watching online. Dr. Ndukwe Nachi, you are present, where are you? Can you say hi? Miss Christy Akoma, can you read? Dr. Pat Ugomeko, I'm sure she's watching online too, and their families. To my loving, hardworking, and supportive late husband, Chief OKORONKWO, I say thank you for your love and care for the family. You encouraged me in every aspect of my educational pursuit and gave me tremendous support. The cold hands of death snatched you away my first month as Dean of the faculty. You did not live to witness this epoch-making event. May your soul continue to rest in the bosom of the Lord until we meet to part no more. To my lovely children, Amarachi OKORONKWO, can you say hi? See you are there. The Anyas, Uchenne, Meka, and Kam Hareda, I'm sure you're watching through the Zoom. They are not case. I'm sure you're here, Dr. Ngozi, Barrister Chika, where are you? Their children, Chidera, Jessie, Chisom. Okay, you are there. Chibobi OKORONKWO, the computer guru, where are you? My appreciation goes to my in-laws. I appreciate my in-laws, His Royal Highness Eze Barrister and Eze PNS Nosike of Ekwerazu local government, Imo State. They are seated in front of me. You are welcome, sir. Thank you for finding time to come here. Retired Deputy Superintendent of Police. Where are you seated? Oliver Anya and family. Okay, you are up there. You are welcome, sir. My sisters-in-law, Ngozi Owuna, and the husband, Ray, Oyidi Onyekuru, and Uwezu Onyukwu, I thank you all for your support. I'm grateful to my Faculty of Health Science and Technology staff and students, where I served as Associate Dean and Dean. I appreciate all the past and present deans of the faculty for their cooperation and contributions in running the faculty. I'm very proud of my department, Department of Nursing Science, which is my base since October 1997, when I joined the university. I acknowledge the support of my head of department, Dr. Chika Ihudie Besplendor, the staff, especially Professor Agnes Anarado and Professor Damwaneri and students. They urged me that I must present this, that's why I had to mention them. Their perseverance has yielded fruit today. My special gratitude goes to the head Department of Health Administration and Management, Dr. Eric Obikeze, staff and students. The department is an emerging leader in health economics, management and policy in Africa. It is a department that broadened my view on health systems management. The department is currently running PGD, MSc and PhD programs in health economics, management and policy. My gratitude goes to all the alumni of the nursing department for their moral and financial support for making this program a huge success. In fact, those of you who visited my platform can witness what I'm saying. The alumni really, somebody said my platform was very gracious. So it was the alumni of the nursing department. Majority are watching online. I say thank you for your moral and financial support and for making this program a huge success. My MSc and PhD students, what I see, the two departments are not left out. Thank you for your support and encouragement. May the Lord reward your labor of love. I appreciate Emeritus Professor T.V. Okafor, my teacher, mentor, and mother. I'm sure she's watching. She saw the talent and potential in me and could not afford to see me, according to her, end up in teaching making in the post-basic school at the National Orthopedic Hospital in Enugu, where I was employed as a nurse tutor after graduating from UNM. She made sure I was employed in the department, being the best variety student during her time. Again, special mention as my mentor too is Professor B. Nwangwu, who provided the opportunity for me to study at the London School of Hygiene, University of London, under the Commonwealth Scholarship. I appreciate Chief Dr. John Eze and Professor E.U. Imaga of the Department of Management, University of Nigeria Enugu campus, who taught and supervised my master's and PhD thesis, respectively. My family church, I will start by thanking my past and present vicars. I don't know whether they are here. Venerable Professor E.O. Kejiofo, Venerable NMPC Yamzi, Venerable ANC Ora, Venerable Emeke Zeji, Venerable Dr. Arin Zegemba, Venerable Chukwudi Chukwubuihem, and all the beloved pastors. Are they there? All the beloved pastors of Christ Redemption Church Anglican Communion for teaching us sound doctrine. I appreciate the Campus Zone Women Fellowship, where I have been the zonal leader for the past 8 years. Thank you for your prayers. I heartily thank every member of Christ Redemption Church, WTC compound, Oguyerugu. May the Lord bless your labor of love. I also thank the Eze of my community, His Royal Highness, Eze Chijoko Bonaya. I think he's there, up there. Can you wait for them, Eze? Thank you for coming all the way from Aba for this occasion. The chairman and members of Item Boat and Women Wing, where are you seated? Item Women and Men. Thank you for coming around to witness this occasion and to celebrate with me on this auspicious occasion. God bless you all. I appreciate my neighbors and friends, Venerable Professor and Dr. Mrs. Arodiwe, a very trusted neighbor and family friend. Barrister and Barrister Mrs. Hubert Mbezurike, Chief and Dr. Ngozi Uzaba. I appreciate Bishop Emeka Igbo. Is he around? Okay. Reverend and Mrs. Felix Ononiwu, Professor Pat Opala, Mr. Ada Wokocha, Dr. and Professor Mrs. Rich Nabuko, Professor Mrs. May Onachuku, Sobi Chudwe, to mention a few. I thank my beloved brethren, the watchers, and my beloved sisters in the prayer and word altar for standing in the gap all through this period. May the Lord reward your labor of love. My inaugural lecture planning committee, my immense gratitude goes to this breed of committed and dedicated friends and professionals, ably led by Professor Anthony Achimwoba. Where is she? The Vice Chairman, Honorable Emeka Obuabo, Secretary Dr. Mrs. Ifi Arize, the Exchequer, Dr. Nelson Ekechukwu, and others too numerous to mention. I thank all of you for taking out time out of your busy schedule to plan this event. May God see you through in all your endeavors. To Professor Waneri, Anarado, and Dr. Hanacho, I say thank you for reading through the entire lecture and making useful contributions. Thank you, thank you, thank you for listening.
You always come true for me, amazing God, oh. You always come true for me, amazing God, amazing God, amazing God, oh. You always come true for me, amazing God.
Thank you. Please sit down. Sit down, everyone. May I invite the chairman to give the post-lecture comments and thereafter make some presentations on behalf of the University of Nigeria.
Ladies and gentlemen, I don't think we have clapped enough. I think, please can we stand up, please, and clap. Some are still sitting down. Please let us give a resounding applause to the inaugural lecturer. A resounding applause. Sit down, please. Sit down, sit down, sit down. You will agree with me that this is a wonderful inaugural lecture. All of us have been held spellbound, and all of us have been paying so much attention during the course of this lecture. There is nobody who did not learn anything in this lecture. Right from the history of nursing, from Ibadan to Ife to UNN, and right now, if anyone wants to start up a university, one of the first departments will be Department of Nursing Sciences. You can see that this topic is well illuminating because she said from silence to a voice. I think they already have a voice. So they already have a voice, and like she said, I agree with most of her submissions. Apart from medicine and surgery, in terms of admission, nursing sciences is the second most sought after course in University of Nigeria. She mentioned all the factors responsible, the increasing need for nurses in Nigeria, which is true. But she didn't mention the Japa syndrome, which is the most important factor. That's the most important factor. Many of them, even when I teach them during their second and third year, I will tell them, when I look at their faces, I will know those who have the calling for nurses, and I know those who want to Japan. So many of them are doing wonderfully well, especially those in the academic sector. They are doing extremely well. You can see we have so many professors here in nursing. Is that also? So they are doing very well. Now, for those of them in the clinical nursing, you have to organize or arrange for a workshop and invite Professor Mrs. IJEOMA OKORONKWO to come and educate you on what to do. Many of you, I also learned about angels of mercy, and I don't know whether you still possess that angels of mercy. All the grammar that she has spoken, what we want as patients is care and love from our nurses. That is the summary of it. So I enjoy you to give that to your patients. Care. Do not shout, do not abuse, do not say any negative things to your patients, no matter the level of provocation. Understand your role, and that's where the ethical standard she was talking about comes in. That's where it comes in. So we have learned a lot today. There's a lot of future prospects for nurses from this lecture. A lot of things she has done tremendously well, and you agree with me that You agree with me that University of Nigeria did not make a mistake by promoting her to the rank of a professor? Please, can we clap for the university? We made the right choice, and it's clearly shown in the person of Professor Mrs. IJEOMA Okoronkwo. In the words of the Dean of Faculty of Health Sciences, she said she has paid her dues. I agree with him, she has paid her dues. So many of you in the academic and health sector, nurses, have paid their dues. So, and she has trained others to take over from her. In case she retires today, she has trained so many PhDs, so many MSc, and so many others. And I want to, on behalf of the Acting Vice Chancellor, I want to thank you for promoting the image of the nursing profession in this great university. I want to thank you. And the university, in our usual manner, want to present to you this certificate of presentation, and it reads, University of Nigeria, be it known that Professor IJEOMA LEWECHI Okoronkwo of the Department of Nursing Sciences delivered the 206th Inaugural Lecture of the University of Nigeria entitled Nurses from Silence to Voice in the Nigerian Healthcare System, the Journey of a Transformational Nurse Academy, on the 13th day of June 2024. Congratulations. It's also important for me to tell this August Assembly that the inaugural lecturer is my own sister. Her Excellency, the one that left, Professor, Emeritus Professor Uchazi Iwe is also my own sister. So you can see we are exporting so many brilliant people to the outside world. Now we are also presenting this plaque to commemorate your inaugural lecture, and it reads, University of Nigeria Inaugural Lecture Series, Professor IJEOMA LEWECHI Okoronkwo, 206th Inaugural Lecture, given this day, Thursday, June 13, 2024. Congratulations. We know you have large family members, and also your fellowship, and also so many people from IJEM and other people are around here to cheer you up. So the university has provided 50 copies of your inaugural lecture that you now distribute among your family and friends.
And then I also want to appreciate the chairman.